Good afternoon. My name is Wally Curran. I'm the Executive Director of the Winship Cancer Institute of Emory University here in Atlanta, Georgia. So to review, proton therapy is a relatively new approach to cancer. Proton, as you recall from high school physics, is the positively charged particle in the middle of any atomic nucleus, and it's actually the nucleus of any hydrogen atom. And there are means of accelerating proton beams to actually deliver a dose of radiation in a more tightly defined area within a person, which may benefit certain patients. Lots of work has been done. There's several dozen proton beam therapy centers within the United States. And one of the appeals for lung cancer patients is that one of the problems with treating patients with locally advanced lung cancer is that some of the tissues around the lung cancer get more radiation dose than we want them to. Two examples are the heart, which in general is not involved with the cancer, but because it's both in front of and behind a number of lymph nodes, it often gets more dose than we plan to, and it can affect heart function. Another area is the esophagus, and therefore it causes trouble with swallowing. And the third area is the spinal cord, for which we want to keep the dose below a certain level. So proton beam therapy sometimes can be planned in a way where we can still give the proper dose to the lung cancer and the surrounding lymph nodes and spare the heart a high dose of radiation. And within radiation oncology, we often view proton beam therapy as another tool for us to consider. We've had a proton beam center here at Emory University in the Winship Cancer Institute for almost 2 years. And in the case of lung cancer, we always do a careful plan using proton beam planning, and we compare it to what we can do with a typical photon or X-ray plan using either 3D radiation or intensity modulated radiation. And we really look for which we believe might be safest and most beneficial for the patient. There are and continue to be several randomized phase 3 trials comparing proton beam therapy to IMRT or other approaches, and these trials are ongoing. But at this point, we view proton beam as one alternative, but not the only alternative for lung cancer patients.